Welcome back to Islanders Insider. Last month was National Athletic Training Month, and this week on our Christus Bond Health System feature, we focus on the Texas A&M University Corpus Christi Athletic Training Program.
When I came in, I was an assistant athletic trainer. I worked with our volleyball program for a couple years, and Mark Bowling was our head athletic trainer at the time. And we were still working on getting accredited in our academic program, in the athletic training program. And so and we used to work out of the Fieldhouse athletic training room, which is about 900 square feet, and of usable space there's probably about 600. You know, I mean, it's really small, and it's just, you know, each year it's just kind of grown from there. So now we have, you know, almost a staff member for every sport. So it's been remarkable in a 10-year kind of time period. Full-time staff on the athletics side, besides myself, Chelsea works with our women's basketball program, Sho works with our men's and women's tennis program, Corey with our track and field, and Tristan with our baseball program.
I come from California, which is the only state in the country that doesn't have a licensure law for athletic training. So all through my high school athletics career, I had no idea what an athletic trainer was. I then went to college to be a collegiate athlete and got hurt about my first 2 weeks of being a collegiate athlete, and actually met my first athletic trainer. And throughout my rehab, I was taking nursing classes and getting ready to take anatomy and physiology, so I was asking a ton of questions. And the athletic trainer told me, "You're in the absolute wrong profession, you should switch over to this one." And I switched over and kind of never looked back from there.
So National Athletic Training, or Athletic Training of the Month, has been established to basically spread awareness in what we do. Okay, some people may think that we are just the water guys, you know, or the person or guy who get a pay giving uncle tape. Yes, we do that, but at the same time, I mean, that's not the whole thing we do. It's just a little part of what we do.
Yeah, it's something that's, I guess, that the general layperson may not realize about athletic training is that, one, it's really not dispensing out ice and ibuprofen or taping up an individual. A lot of people refer to us as trainers, you know, and that's kind of a general term. For us to really kind of identify us is athletic trainers. That name really doesn't describe what we do. I mean, we work in not only in a setting, traditional settings such as a high school or a college area, but we also have athletic trainers that work in an industrial setting, performing arts, military settings such as the tactical medicine. But so that, I would say, is probably confusing for a lot of people that really don't understand us in the allied healthcare system.
Yeah, like, I mean, I totally agree with Jerry, and that's the still perception I get from, you know, people who don't really know what's going on in athletic training professions. Like, I guess the things that I can give you as an example would be, you know, giving them a therapeutic rehab after the surgery. Okay, we'll collaborate, work very closely with the physician so we can follow up with each of the student athletes. I personally do a lot of manual therapy. I really think it works a lot and give a student athlete immediate effect from that therapy.
So we don't only just do musculoskeletal injuries, we also help with things like mental health disorders. If they need assistance with that, we can refer them for nutrition if that's something that they need as well. So we come in, and while we do help people who have ACL tears and ankle sprains, we also help them with, you know, all of their healthcare needs.
Essentially, the athletic training program here at Texas A&M Corpus Christi is a 4-year program. Our students actually apply to the university and then they apply to the program. So they have to have a secondary admission process, and so we accept very few students. We accept about 15 students a year, and our students then work with intercollegiate athletics. So our classes are a lot smaller, but our students are part of an accredited program, and so they actually have to learn a specific curriculum. So it's very much guided by CAATE, the Commission on Accreditation of Athletic Training.
So I generally teach 1 to 2 classes a semester in the athletic training program. Teach everything from the clinical skills that our students learn, so they might come into class one day and we might actually go over some slides and then take them over and actually do a hands-on approach. So whether or not we're teaching them a special test and then they walk over to the clinical side and actually get to test the special test on their peers before they go out and they do that with a student athlete. Or we might teach something like a life-saving device. So today I just went over AED with one of my students. We talked about AED use, CPR use, EpiPen use, oxygen use, things that can actually save a life.
Our students in their first year in the program, they complete 100 clinical hours with different sports at the university, and then their last 3 years in the program, they actually complete 200 hours a semester with different sports in our program. And so that is part of their education as well as classroom, so they have to learn specific things for accreditation. That prepares them to actually take the National Board of Certification exam. With the National Board of Certification exam, they're eligible to work in any of the 50 United States, as well as about 6 outside of the United States. So our students within the athletic training program are actually very involved in the community, both here at Texas A&M Corpus Christi. They work with all of the Islander sports teams. In addition, we also work with ROTC, which is a little bit unique, that tactical medicine. We are also out at the high schools, so we have about 6 high schools right now that we're working with. We're looking to expand. They work with pretty much all of the high school athletes from, all levels, from junior varsity, varsity, and so our students are very engaged with that. They also have a student athletic trainer club that does community service projects in the community as well.
I think when I first got here, we had sort of a minimal number of students applying. We were trying to meet numbers, so we were kind of accepting anybody who met the criteria. This year, we actually started off the year with over 40 people applying for 14 spots. And that really allowed us to go through and make some more clinical judgments on the students that we decided to allow into the program. So I think that's going to give us a really strong pool for this year.
Lung cancer is the leading cancer killer in both men and women. Because most cases are diagnosed in the most advanced stage, early detection is the key to survival. Are you between the age of 55 and 74? Have a smoking history of at least 30 pack years? Radiology and Imaging of South Texas and Christus Spohn Cancer Center have joined together to offer affordable lung cancer screenings. Call 1-855-557-7646 to schedule, because what you can't see can kill you.